President.
Senator from Massachusetts.
Mr. President, last year, 2,000 people in Massachusetts died from opioid overdoses. If the same number died in America, it would have been 100,000 people. Now, thank God, because of the Affordable Care Act, many of those people received treatment who otherwise would have passed away last year. The number would have been a much larger number across our state and across the country. But because of the Affordable Care Act, the number was low, but that number was still much too high. And I want to be able to tell the people in Massachusetts what the impact of the Republican health bill will be on their families in terms of getting access to the opioid addiction treatment which they'll need, so that the number doesn't continue to go up but goes down. And I want to be able to tell them what that coverage will be before I vote upon it. But the majority just won't let that happen. They're keeping the bill hidden. They don't plan to make it public until the very last minute, with less than a day to view it before we vote upon it. That will be catastrophic for those families that need opioid addiction treatment. Absolutely catastrophic. So I have a unanimous consent request, Mr. President. I ask unanimous consent that no motion to proceed to calendar number 120, H.R. 1628, the American Health Care Act, be in order until the bill has been the subject of executive session meetings in the Committee on Finance and the Committee on Health, Education, Labor, and Pensions, during which amendments from the majority and minority receive votes, and the bill has been reported favorably from the committees.
Is there objection?
Object.
Objection is heard. Massachusetts.
Thank you, Mr. President. Mr. President, when I was home in Massachusetts this weekend, I constantly had people coming up to me asking me about the secret Republican health care bill. What was in it? How was it going to affect their families? Because, to use Donald Trump's word, they're afraid that it's going to increase premiums, and that would be mean, that it's going to make it possible for insurers to deny coverage for pre-existing conditions, and that would be mean, that it would create an age tax for older Americans. That would be mean, that it would cut Medicaid coverage for grandma and grandpa to get a nursing home bed if they had Alzheimer's. That would be mean. And so the question that kept coming to me all weekend, recurring, was, is this secret bill really meant to cut all of the funding that goes for the poor, the sick, the elderly, the disabled, so they can give tax breaks to the wealthiest people in America? Can we get that out so that people can see that? And they also said to me that they didn't want to be fooled, because their fear is that Trumpcare is as much a health care bill as Trump University, a college institution, and that there really isn't any real health care in it, and that it's cruel, it's inhumane, and it's immoral. So we're demanding that the Republicans show us the bill, that the American public can see, the American people can see the bill, and they can understand what's in it, because the consequences for their family's health is so dramatic. And so as a result, I ask unanimous consent, Mr. President, that the calendar 120, H.R. 1628, the American Health Care Act, be referred jointly to the Committee on Finance and the Committee on Health, Education, Labor, and Pensions, with instructions to report the bill with changes to eliminate provisions that, 1, increase health insurance costs, 2, reduce coverage, 3, make health care less affordable for those with pre-existing conditions, and 4, reduce tax liabilities for corporations and individuals with incomes over $1 million. I ask unanimous consent, Mr. President, that that motion be put in order.
Is there objection?
Object.
Objection is heard.